Hello, my name is Evelyn. I'll be your student nurse. Can I have your name and date of birth, please?
My name is Mr. W. My date of birth is September the 2nd, 1940.
Okay, I'm going to wash my hands and I'm going to check your armband. And I have the right patient. Do you have any complaints for today?
Yes, shortness of breath.
Okay, what kind of symptoms do you have with that?
I have like cold, like flu symptoms. And I'm coughing up thick yellow sputum.
Okay, when did it start?
3 days ago.
And how long does it occur?
Like a minute.
Okay, how severe is it?
Well, if I'm exercising and walking around the house, I start getting like shortness of breath, and then my chest started to get tight, so I sit down and I stop.
What makes it better?
Sitting in my recliner.
Okay, and how about any other symptoms that occur with it?
No. Other than the tightness of the chest.
Okay. Now I'll check your vital signs. I'm gonna check your blood pressure, which is 120/80, and now I'll check your pulse is 80, and the rhythm is regular. And now I will check for your respiratory rate. It is 20, and that rhythm is also regular. And now I will check for your temperature is 97.8. And are you in any pain for today?
No.
Okay. So all vital signs are within normal limits for my patients. And now we'll check the orientation. Do you know where you are?
Yes.
Do you know what time it is?
Yes.
And do you know where the time of day it is right now?
Yes, it's nighttime. I'm at the hospital.
And who are you?
My name is Mr. W.
Okay, and where are you?
I'm in the hospital.
Okay. So patient is oriented ×3, and patient seems awake without any stupor. Do you have any like social support, family, anything like that?
My son.
Okay, let me check your pupils.
Okay.
So pupils are equal and reactive to light. And now we'll check communication. She speaks English fluently, and her mood is pleasant, and she is very cooperative with all my care. Now I'll check for your skin. The skin is brown without any lesions, without any erythema or jaundice. There's no swelling. Check capillary refill. Returns within 2 seconds. Check your temperature. Dorsal. It is warm and dry to touch, and there is no the skin is also dry without any clamminess. Now I'll check for your skin turgor. There's no tinting. Now, do you have any wounds or drains?
Oh.
So patient has no wounds or drains. And now we'll check for respiratory rate. So can you breathe and exhale? Okay. Again. Okay. Again. 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 And again. So lung sounds are clear without any adventition sounds. Her breathing is unlabored. Do you have any coughs? You say you have like the sputum, right?
Yeah.
So you have like a little cough.
Okay. It be yellow.
So patient has yellow sputum when she coughs. Now we'll check for your heart sounds. Okay, I will start with the aortic. Now we'll listen with the diaphragm and the bell. Then I will go to the pulmonic, and I will check with the diaphragm as well as the bell. Now I will go to the Erb's point, and I will listen with the diaphragm and the bell. And then I will go to the tricuspid, and I will listen with the diaphragm and the bell. And lastly, I go to the mitral valve, and I'll listen with the diaphragm and the bell. So S1 and S2 sounds were audible in all quadrants, and there were no signs of murmurs. Now we'll check your pulses bilaterally. So pulses are present +2 bilaterally and regular. I did capillary refill already. So now we'll no edema, as I already stated as well. Let me see your legs. No edema, no lesions. The skin is brown. Okay. Now can you lay down for me? And I'll go to the patient's right side to check for jugular vein distension. And I'll have the patient look to the left for me. I'll use my pen light. I don't see any bounding or anything distending, so that's normal. Okay. All right, you can get up for me. Do you have any diarrhea or constipation? So your bowels are regular, which is okay. How about your last bowel movement?
This morning.
At what time?
Well, late, like 11.
Okay. Do you have any blood in your stool or any of that going on?
No.
How about any digestion problems? Like, do you vomit, throw up, any of that?
No.
Or do you get nauseated?
No.
Okay. And can you lay back down so I can check for your contour? I will look for a patient's stomach contour at the end of the bed and on the side. Patient has a flat stomach contour. And I palpated, it is soft, very soft. And I will listen to the bowel sounds in all 4 quadrants. By the way, was that palpation tender at all? Okay. And I'll listen for a full minute in each quadrant. And I will actually time that.
Right.
Okay. So bowel sounds are present in all 4 quadrants, and bowel sounds were hypoactive, as should be. So do you have any urinary problems?
No.
Any like screen problems? Do you have any blood in your urine?
No.
What color is it?
It's like close to like clear. Cause I
And
drink
how
a
is
lot
the
of water.
consistency? Like, is it thick or anything, just normal? Okay, are you incontinent? So you are continent? Okay. Do you have any like numbness or tingling, anything like that? Do you self-ambulate? Or do you need like a walker or
I don't need
any
no
of
help.
that? Okay. So can you stand for me?
Yes.
You're gonna do your range of motions.
Okay.
Can you abduct your arm? Adduct. Fully extended upward and backwards. Okay, so patient has full range of motions. Okay, now with your leg, can you flex it and extend both sides for me? Okay. Can you pull back on my arm? Okay. Can you pull back? Okay. Can you pull back? Okay. Can you pull back? Okay. Can you take off your shoes so I can do your Peter pulses?
Yes.
Okay. So posterior tibialis. So pulses are +2 bilaterally. And that concludes my assessment.